So my minor at SF State is holistic health, which is more of you know a, a whole approach to health. This goes with spirit, mind, body, um, alternative medicines if you want to look at it in some aspects. But this semester, which was in fall of 2014, I took autogenic training in embodied living with Ken Burrows, who's one of my favorite teachers there. And autogenic training is more of a like a kind of like a it's not a it's a in body meditation where you're not trying to leave your body, but you're in there, and then you're telling yourself, my left arm is heavy, my left arm is heavy. You repeat the different I guess you can say mantras if you want to go that way, but autogenic training is uh, a Western approach to health. But it was really interesting because we would, you'd have these three different poses: or the coachman pose, the easy chair pose, and the supine pose, which is easy for me to fall asleep in. But then, we would do, heaviness. Like I said, my left arm is heavy, and then you would try to control the I guess the sensations or whatnot that was in your arm, such as my left hand is warm. My left hand is warm, and you would try to do that. The other one is listen to your heart. Taking deep breaths, respiration, the solar plexus, forehead cooling, and neck and shoulder relaxation. And autogenic training came out of hypnosis. And the other part was embodied living, which, like I said, this was an 8-hour day on probably like 7 or 8 Saturdays throughout the semester. And we'd have different people, different guest speakers, and some of them were about embodied living, like dancing, which is really amazing. Really good way to approach it. And of course the different types of course your meditation, and then your movement meditation. I'm trying to think of some of the approaches that people had, but yeah, it was a really good course. I wish I was able to. I've been busy, so I wasn't able to practice this as much as I wanted to this semester. But yeah, autogenic training was a good course. And at the end of the semester, what we had to do was the other part of it says embodied living, but a major part of it too was healing, art for healing. And so if you go to the hospitals, people would have you would see people with music playing with children. Well, I work in children's hospital, and this helps people heal, even though they're not curing but healing, helping them feel at peace. That goes with art too. Kids would draw and dance, all kinds of creative arts. And so one of our last things, our last part of the class was we had a circle, and it's more of a Native American tradition, and it was a sacred place where we would talk about an issue that was bugging us. People would talk about these issues, and emotions get high in some of these things. And so it was, but for me, a lot of my emotions came out too, and it was definitely interesting because I'd never thought talking about some of these issues, patients passing away, and I feel attached somewhat. I can't work like a machine. So but to let that out was very very relieving, and it almost helped, like I said, it helped me heal and understand better. It was a great course, and I loved the, it's another way to somewhat meditate, and they say if you can do it really well, it's like you can try to heal yourself. So definitely was a great class, and he teaches it every 2 years, so I'm glad I was able to get this.